Okay, welcome everybody. I am attempting to get somehow, some way I got off the internet. So we're gonna try to get people back on here. Sorry about that. Just lost Linda. Let's see. Okay. Hi guys. Sorry about that. We're reconnecting here. You will have to redo your audio again. I see that your audio is off. So I put it on. There you go. You're on now. Thank you. Let me just make a little remark here of who I am, and then we'll get going. There we go. Done. Thank you. Okay. So we have a couple people joining us today on our little class today. So welcome everybody. I'm Dr. Denise Rassel, and I am here with Linda and Fran. Introduce yourselves.
I'm Linda.
I'm Fran.
Okay, and they are with Adelpha Breast Thermography. And the reason why I'm doing this today is because I would like people to understand what breast thermography is all about and how it's different than the traditional medical model, a little bit about their history, Linda and Fran's history, and how they're serving the Michigan community, Michigan and Ohio. So if you guys wouldn't mind, go ahead and take this time to introduce yourselves and a little bit about your history and what is Adelpha Breast Thermography all about.
Well, that's a mouthful. So let's start with the most recent. In 2011, the clinic director of Thermoscan asked Linda and I if we would be willing to have a mobile unit for them. At the time, they were looking for women who were dedicated to thermography. We had had ours with them for 5 and 10 years
20?
at that point. Yeah, now
years.
it's over 20 years. They wanted women who were compassionate. They wanted women. And they also wanted women who had some type of medical background. So Linda has been critical care. She was a critical care nurse for over 30 years, extensive background. She then saw that patients weren't necessarily healing, even if they were curing them and patching them up. So what happened was she started to study subtle energies, massage therapy, became quite accomplished in a lot of different techniques, and was a perfect candidate for being able to support women in taking care of their health. I, on the other hand, had a healing crisis, and it led me to a chiropractor. So I very much appreciate what you were doing in your health clinics, because I wouldn't be here today without chiropractic. And then when I retired, moved to Michigan, met Linda, and we began working together. And most recently, we were really honored when the interpretation part of the business for Thermoscan moved to Arizona, and they asked us to take over the managing of the main office here in Michigan. That sums that up.
It does.
Now, you also asked about breast thermography.
Yes, can you explain what is breast thermography?
Well, basically, it's about reading the temperature differentials in the breast tissue. Temperature, right and left, should be the same, although we're not all exactly symmetrical. And our interpretation is different than other thermography companies because we also add what's called the physiological test. And that test tells us also about the vasoconstriction, the vessel constriction, and whether it's acting normally or not, because it doesn't act normally when there's disease process starting or when there's a cancer. So what we're looking for is we're taking an infrared camera, No x-rays, no compression, no pain. We're taking pictures and looking for the heat patterns and the vasoconstriction of the blood vessels to see if there's any aberrancy in that heat pattern, which would indicate a change in function. And so we're looking for a functional change rather than a structural change, because I'm sure most of your patients understand the difference between having a functional change versus years later developing a structural, such as inflammation in a joint can happen for years and decades before you might get a knobby arthritic joint. So we want to find it at the functional, physiological stages, any heat aberrancies, way before a tumor can be, which is the structure, can be identified. So that's basically what we're doing. We're giving women an opportunity to have the earliest breast screening. We're eliminating the fear of compression, the threat of x-rays, and giving them years and years pre-knowledge if there are any changes in the breast tissue, so that they have years to reverse the process.
Changes can show up 5 to 8 years before a mammogram will see it. So they have lots of time to do something so it doesn't become something mammogram can see.
So, you know, you'd think if this is true, which you're saying 5 to 8 years, you've been doing this for now, how many years?
Well, we've been having it done to ourselves for 20, 25 years. However, we've been physically doing the thermograms with women since 2011.
So
Well, the thing, and really I think what you're asking about is the length of time, how valid is this? And it's quite fascinating, but we'd have to go back to the 1970s. And there actually was thermographic equipment in the 1970s. And at that time, the federal government was putting through some major public health programs. And part of that was a study that they created for women's breast cancer. And that's because 1 in 14 women were developing cancer. But by the 1970s, it was 1 in 20. By the way, obviously the system hasn't been working because now it's 1 in 8 women are developing cancer. Very, very closely nearing 1 in 7. So they developed.
Let me just clarify that. That is 1 in 8 breast cancer.
1 in 8 women develop breast cancer today.
Okay. All right.
So when you think about it, you go over to somebody's home and you're having a book club and there's 15 people there, you're going to have 1 or 2 women develop cancer. Somebody,
breast cancer.
Breast cancer. Somebody, I mean, I don't know anyone who doesn't have a family member, a friend, or someone they've heard of that has breast cancer. That's how prevalent it is. So this system is flawed in terms of detection. And it started in the 1970s because what we knew at that time was about x-rays. What we know now is the 3 most sensitive tissues in the body, the eyes, the thyroid, and the breast tissue, to x-rays means that x-rays can be incredibly harmful. And what they did was develop a study, and they tacked on thermography at the end of the study. They realized there was another modality, but they only had radiologists, people who understood x-rays, reading the results. They didn't know how important temperature was because there's a very specific temperature, and we'll go into that during the procedure, of when it's the most effective. And so they didn't get good, valid results. That's why radiologists read x-rays, thermologists read thermograms. And so what happened was that we ended up with a very high risk procedure, using radiation, which creates cancer. And at that time, they opened it up for insurance. So it's a double whammy, that we have a high risk And yet it's the gold standard because it's the only procedure that insurance companies will cover. And they, in fact, they won't even let you get more effective testing unless you get a mammogram first.
Mm.
So it's definitely a flawed system,
Mhm.
especially when we know that mammograms at best are 85% effective.
Mm.
But if you have implants, surgical reductions, biopsies, if you're pregnant or breastfeeding, or if you have a very fast growing tumor, the results are significantly degraded. And even more than that, how many women have been told they have dense breasts or they have large or particularly small breasts? That's about everybody I know. And the significance in that is that mammograms are degraded as low as 44% if you fall in any of those categories, including taking bioidentical hormones.
I'm taking notes here.
Okay, so what we have is a very flawed system based on a flawed study.
Yeah.
And that's the study that's quoted whenever somebody is putting thermography down in order to support the gold standard mammography.
Mm-hmm.
And more important, we mentioned structure and function before.
Yeah.
That the mammography is looking for structure. It's looking for disease. That's what medicine does. They look for disease. So you have to have a tumor of a certain size before an x-ray can pick it up. So what we want to see is what are the functional changes that happen years before a structure? And I can give you a very good example of that. Very often there are calcium deposits in the breast tissue when there's a tumor. Imagine how long it takes for a calcium deposit to develop, just like our example of inflammation and pain before arthritic knobby joints. So when there's a change in a heat signature, years before calcium deposits can develop, we can pick that up. And the reason for that is because blood vessels that grow to feed a cancer, it's in a way, it's the disease puts out this communication that says, feed me, feed me.
Right.
And so blood vessels develop to bring blood to the area to nourish the disease. And that's what we're looking for, those blood vessels very early on. And what separates us from other interpretation companies is we're the foremost leader in interpreting and one of the only companies that do what's called a cold stress test. And that's a physiological test. That cold stress test actually tells us, are the blood vessels contracting?
Mm-hmm.
Because healthy blood vessels contract and unhealthy blood vessels do not. And that's why we are now the gold standard of thermography.
So what I hear that you're saying, and quite possibly people do not understand that the traditional medical approach with thermography, or not with thermography, but mammography is actually an X-ray. It's radiation. So they compress. If people have not had one, I personally have had one in my life. And my experience was I went in and I had to put my breast in between two plates very close to my body, and then they squished it, and then they kept it there, and then it was an X-ray unit that put there's radiation with different frequencies of X-ray. Here with our X-ray equipment, it's high frequency and very low radiation with the high frequency X-rays. Now this was probably 10 years ago, before I knew much about thermography. And it was not a pleasant experience. And I know people that they go every year for a mammogram, and I'm like, that's a high sensitive tissue. You've got like you said, eyes, thyroid, breast, I would have to say your brain, but these are, you know, highly sensitive areas. And when you're radiating them on a regular basis, that can promote cancer instead of reducing cancer, right? I mean,
and it's much worse than what you're saying, because yes, your experience is 10 years ago. Well, at that time, most people had mammography done. Or those, I shouldn't say most people, those that did, because in fact, 70% of women have never had any breast testing because of the fear, the misinformation, and that intuitive knowing that it's just not good for you.
Not good for you, yeah.
Nowadays, what we hear from women is, oh, no problem, I had 3D mammography. Well, 3D mammography is also called diagnostic. Very often you would have a mammogram 10 years ago. You'd have a mammogram, and if they suspected anything at all, they'd have you come in again, and then they do the 3D. And that's a panoramic scanning of the breast tissue. And then they're able to set up those pictures in a way to see a 3D version of the breast. It's a lot more pictures. And even though the equipment has been developed that they can use a slightly less radiation, which is what they say, you're doing more pictures. So you're using a lot of radiation.
And every time you have a mammogram, it increases your risk of breast cancer by 1%.
Only 1%.
Yeah, but a lot of people we see, they've had 30 and 40 mammograms.
Yeah.
Right.
So, you know, they've increased their risk up to 30 and 40%. That's pretty significant.
It is significant.
The majority of women either have never had any breast testing, and then they're the 1 in 8 who get surprised, or they've had mammograms repeatedly. So most fall into one or the other extreme. Rather than looking at the solution, how do we determine, are your breasts healthy? That's really what's critical to, I would say, for everyone to understand. A mammogram does not tell you if your breasts are healthy. Only trusted 14 to 20% effective at saying you're free of cancer. A thermogram can tell you with 90% accuracy, no test is 100%. So it's part of a comprehensive program for your breast, but we can tell 90% of the time, are your breasts healthy? And this gives you a marker to say, all right, maybe I need to change my lifestyle. Maybe I need to exercise more, change my diet, turn on my innate wisdom and intelligence with chiropractic care, get more in touch with my physical body so that it communicates with me when something's not working well. We've lost that connection. That's what's so vital about the work that you do, is that supports our community in really being in touch with our own body, freeing up the communication system that we have. And that's why thermography is such an important part of these lifestyle changes.
Well, I personally studied thermography in chiropractic school over 20 years ago, and I'm certified in thermography from 20 years ago. And so I understand the concepts of the right and left, and that we want to see balance. In fact, we do use at our Frandor office, we do a type of thermography that does read off the spine. And for chiropractic, I really, really like Dr. Stillwagon's work with the Visitherm, which was a full back, almost a full back, thermography scan up the spine, and you could see out from the spine. And it's basically picking up temperature. So we know that when there's subluxation, you can get vasodilation right away when it's an acute issue. You get vasodilation, a heated area. But if it's been there a long time, then you get vasoconstriction, which now you get a cold reading. So I understand that. I love thermography. I love what it picks up. It's very early, way, way, way before pain is ever an issue. And I think that the concept of being proactive with our health is something that our American community, I'm not sure about the world, but I do know that you're either into health or you're into sickness, and that's in response to a disease process that has already been set up and going for how many years. So I know when I get somebody in pain, it's usually been a process that's been set up for definitely well over 10 years, if not 20, 30, 40 years, a disease. So let's say, just say a disease process in the spine, which is degenerative joint disease. And so we do combat that in our practice. So we are all for being proactive with our health. So in our practices, we have chiropractic, nutrition, scoliosis, neuropathy, so many things that we want to provide not only our own family, our own selves, but the families that do come to our practice. We want to be proactive with nutrition, nutritional supplements, coaching, chiropractic, posture. I mean, there's so much to be proactive with our health. And this is why we at Gilead Healing Center and Rassel-Daigneault Holistic Health Center, both located in Lansing, have been partnering with Adelpha breast thermography, is because this is a service that we want to provide our patients and our community. You don't have to be a patient of ours to come and receive thermography services when Adelpha comes into our locations and provides this service. You do not need to be a patient, and we want to open this up, and this is why we're doing this educational webinar today, and to inform our community that there is a choice on women's health and being proactive with taking care of the health of our breast tissue, which you know, the statistics are staggering. What you told me, that it's only, you know, we have only 85%. We have one in 8 women, 1 in 8 women with breast that will develop breast cancer. That is the current statistics. And we also know that, you know, the current statistics for a human is more than 1 in 3 will get cancer, period.
And the of those that mammography identifies, 1 in 5 of those women are getting treated unnecessarily, because they find that those, whatever they found, is not life-threatening. And you brought up a couple of good points. You know, it's not just women. Men develop breast cancer.
Yes.
10% of men, especially at the time of male menopause, when testosterone levels change, it's really important. And you also brought up about thermography in the spine. The reason why it works so well with the spine is because we've got the blood vessels close to the surface of the body, and we get a very accurate reading when it comes to the spine. That's why we do breast, carotid, and thyroid, because those blood vessels are close to the surface as well. In our clinic, we prefer not doing what these Vogue full body scans are all about.
Sure.
Because the blood vessels are so deep within the body, the heat signatures are so deep, that you basically know if you have a digestive disorder by your symptoms. And so for us to say that, oh, there's a hot spot somewhere over your abdomen, well, is that the stomach, the liver, the spleen, the kidneys? So you know, it's amazing how accurate thermography can be, and how simple. You know, maybe Linda, maybe you should go over the procedure. It's so simple.
Yeah. So you basically come in and acclimate in the room temperature. So we have you just roll from the waist up, and you're going to sit kind of like this for about 12 to 13 minutes. And then we do 3 pictures in front of the camera. It's an infrared camera. And we do a front and 2 side views. I can show you a picture. And then you put your hands in the lovely cold water for 1 minute. And then we do 3 more pitches, and that's it.
That's the functional test, the cold water.
very
Seeing are
simple.
those vessels constricting or
So
not?
this is what the views and what the pictures actually look like when we do them. So we do 3, and then we repeat those 3 same positions after the cold water.
And the whole process takes 30 minutes, including reviewing a breast health history. And that's it.
It's very simple.
And then the report is sent out within 1 to 2 weeks, typically, except during October, because everybody wants to come in during Breast Cancer Awareness Month. Hello, we'd rather you come in the rest of the year for breast health awareness, when it may take a little longer then. And the report is also sent to a medical doctor. We find that it must go to somebody who can order follow-up tests, because for that 30% of women, way more than mammography points out, that may be developing a disease process. We want a doctor to be able to work with them if they need follow-up testing, preferably to do non-invasive testing, such as, or less invasive testing. First of all, physical exams, or possibly an ultrasound before the gold standard mammography that could cause cancer. So we do insist on sending a copy of the report to a medical doctor. However, the patient gets a copy of their report, empowering women to see what their results are, to determine what to do, to share it with those practitioners who know how to work with lifestyle changes. And the most important thing you said for me is that you share what you do for yourselves. And that level of integrity, those are the practitioners we want to work with, practitioners such as yourself.
So let's talk about lifestyle a little bit.
Okay.
There are some correlations with certain lifestyles, such as obesity. I was shocked when I saw the latest numbers. It's 42%. And I remember I was doing weight loss coaching. We still offer weight loss. That's another lifestyle coaching we do is with Nutrimost. We do weight loss powered by Nutrimost, which is highly effective. People lose a minimum of 20 pounds in a matter of 40 days, and quite often more, but it changes a person's ability to manage their food intake, their snacking, all that. Teaches them to eat properly for the rest of their life. However, when I first started in Nutrimost so many years ago, I want to say maybe 8 to 10 years ago, the statistics were more like 25% obesity and on the rise. And the focus was in prevention, again, with the diabetic or pre-diabetic population. And so 42% right now of Americans, adults, and 16% children are obese. 16%. And it's tied with
rising
pre-diabetic in cancer and heart disease. So these are correlations. If you're overweight, you will have a higher prevalence towards breast cancer, heart disease, and diabetes. In fact, that is a high correlation. There's no getting around it. So what we put in our bodies, what we're eating, and we can't get away from our environment, right? Can't get away from our environment, so we need to be aware of what we're putting in our bodies, on our bodies, chemicals coming in, because chemicals are high correlation to cancer. Chemicals cause cancer. You can't get around that fact either. So what's in our water, what's in our medications, vaccinations, our food, our genetically modified, our animals that we're eating that are vaccinated, that are hormones.
Yeah.
Higher prevalence of breast cancer with what did you say? Are bioidentical, or not necessarily bioidenticals, but you had mentioned bioidenticals. There are a lot of women on Premarin and Prempro. They still do that.
Mhm. Yeah, and what you're bringing up too about the environment, you know, the chemicals in the environment are mimicking estrogen in our body. They're called xenoestrogens, and there's different aspects and other parts of it. What it does is it mimics what's in our body. So unless we can somehow detoxify or be more aware of those lifestyle changes, such as what foods can support us in altering that, and also the importance of organic in certain areas. We can't do 100% organic. Many of the things that are labeled organic aren't. How do we educate ourselves about what's truly best for ourselves or not? We do recommend a book to a lot of women. It's a very simple read. It's called The Estrogenic Diet. I don't remember the gentleman's name right now. His first name is Ori, O-R-I. The last name starts with an H. And, but you type in estrogenic diet in the computer and it'll come up. It's a very easy read and really shows you where some of these chemicals are coming from. Dry cleaning, although we don't use it much today, we still do. And the environment and our water and what's happening, so that we can see how do we combat that. What are good nutritional formulas for the breast tissue? How do we take care of our overall health? Definitely weight is number one as far as I'm concerned.
Underwire bras.
Yeah, underwire bras that attract electromagnetic pollution, which is another issue. But also stop the lymph flow.
But I'm sorry, what did?
It stops the flow of the lymph.
Oh, okay, yeah.
The underwire bars. And there's just a number of things that women can do for themselves and bring awareness to. So it comes down to being exposed to the information, which is what you're able to support your community with, to know how to approach this, how to care for ourselves, what's our next step, what's our next priority in how to care for ourselves. And for women, breasts are important. It's important to how we feel, how we look, and to our health.
Yep, absolutely. Now, I've had breast thermography done twice, and I just want to go over my experience from a patient perspective coming in. So from a patient perspective, you go into the room, you do disrobe from the waist on up. So yes, you are exposed, but there's only Linda in the room.
Yeah.
So you got to get over that a little bit in order to get the information. So you do have to, you are sitting there with your arms up, and the reason for that is to not have anything rubbing on your skin. Let the air. It is a cooler temperature in the room, and you're letting your body normalize. So you need to do that for I think 10 to 15 minutes, correct?
Right.
And then you put your hands in cold water, and that's to get your body to respond. The arteries or the capillaries to vasoconstrict, and to get some really good information. And that I would assume that gives us information about the lymph system as well.
Well, yeah, we in every picture, we also see the underarms. So it's even up to the armpits, we're looking at those lymph vessels.
Yeah, so that is vital, and that's not something I think mammography would ever get into. So, it seems like breast thermography should be the gold standard. Non-invasive, non-cancer causing, there is no side effect. repeat that. There is no negative side effect to having thermography. It's just picking up. It's like taking your temperature. There's there's no side effect. So how often do you recommend having thermography?
Typically, we recommend annually because it shows changes so soon. But women need to look at the report because recommended follow-up time is on the report. So if there's anything other than normal, there'll be a sooner recommendation for follow-up, either 3 months or 6 months, somewhere in that time frame.
And anyone who has had surgery on the breast tissue, that changes the vasculature.
Mhm.
So they will have you come in every 9 months instead of 12. It needs to be watched more closely. We gather more information once we get that baseline, but typically for women, because we do before and after with the cold water, it's a built-in baseline and physiological change right from the first scan. And more important is breast cancer, as you mentioned, takes years, can take decades to develop. And there are high-risk breast cancers, particularly women with the BRCA1 and 2 gene. However, the majority of women, it's a very slow process. So the earlier you start taking pictures, the sooner we can catch the most minute change in the vasculature, in those abnormal blood vessels. So we recommend starting anywhere from 25 to 30 years old.
So because you can compare picture to picture,
Right.
and comparison is golden.
Yeah, and every year when Thermoscan does an analogy, they show the comparison from all the previous scans before. So you can always see, what you've been doing throughout the years.
Yeah, that is really good information. We like that. In chiropractic, we like that. We compare x-ray to watch improvements. We'll see worsening. If people haven't been in 10 years and we take an x-ray, we can see where they've gotten worse. So it's good to have those comparatives. That's vital information. So could you tell us a little bit about how a person would, where do you go? How would one get a scan done if they're not in Lansing?
Oh, we go to your clinics, which we're very happy to do that, and very grateful that you have us come in Gilead and Rassel at Brandor, right?
Yeah.
Remember to do that. So we go there several times a year between the two places, and you just have other places. We go all over Michigan. We have about 30 different locations, and you just have to call me at Adelpha Thermography.
And the website is Adelpha. That's like Adelphi, but an A at the end. Adelpha Thermography. And then, of course, the main office in Southeast Michigan is Thermoscan of Michigan, and that's at 248-593-8700. So there's usually somebody's available or gets back to you within a couple of hours at this office, and can always get you in touch with Linda and Adelpha.
Yeah, Adelpha is 248-797-1191.
Awesome. And are you aware of if a person's in another state, is there a website, a referral website for anything countrywide?
Yeah, Thermoscan Reference Laboratory, that's the interpretation side of the business. They're in Arizona, and their website is Thermoscan, Therma, Thermascan, SCAN.com. Our website has many links to them, and that's thermoscan-thermography.com.
Okay.
And Thermoscan.com has a list of every state and all the people who do thermography for thermoscan.
All right.
So
Well, that
they have doctors from all over the country
Yeah.
who send their scans to them in particular.
oh, that's really good information to have. So, what questions do people come and what are the top questions maybe that you can identify that people often come in with?
Well, we pretty much covered, I think, those, how often should you have it done
Mm-hmm.
and what age. Why thermography over other companies, if we didn't cover that.
Yeah, I would say the only other question that's pretty common is, all right, they found something on my report, now what?
Mm.
You know, we're so indoctrinated with the medical model to panic when we discover something.
Sure.
So I have to remember that this is at a functional change, not the structural change that could develop years later. But we do have a grading system. A lot of companies only look for hotspots, right and left comparison. They're not doing the cold stress test. We have, our cameras are called radiometric. It's different than just taking an imaging picture like a regular camera does. And a lot of companies use those imaging cameras. With a radiometric camera, we have quantitative measurements that are analyzed by the camera itself. This is the highest grade medical camera you can get. And I lost my train of thought. So where were we going?
Radiometric.
So, so what we're often asked is, what do we do when something is discovered on the report?
Mm-hmm.
So we have this grading system. A TH1 is normal. A TH2 is normal with a caveat. And that is, it usually shows what's called estrogen dominance. A mainstream medical doctor would have no clue what to do with that result. They see it as normal, they do nothing.
Oh, dense breast too, will show up as
Yeah.
a TH2.
Yeah, dense breast can as well. And so only somebody who's working in the alternative field, which I would put chiropractic in for sure, although many people are now learning that chiropractic is mainstream. And so that's the only people we can go to learn what to do. Is there anything we can do to support even a healthier breast tissue? A TH3 is one of those gray areas because there's a less than 10% chance that you will develop breast cancer. Well, what does that mean? Can I be proactive now? With those numbers, medicine does nothing but have you do follow-up testing. But that's really when we can be proactive in lifestyle changes. And of course, a follow-up test is important because we can see minute changes over time that with mammography being an X-ray, a tumor has to grow to a certain size before it will pick up a difference. So we have these various categories that make it quantitative. And most companies do not use that quantitative analysis. They're looking for just right and left imaging, colors looking the same, not looking at 1/100th of a degree temperature differentials. And that's how the measurements are so finite with thermoscan.
Wow, that's amazing. We have a question here from a participant. And let's see, the question is, when can I schedule my first thermogram at the Frandor location? Have we set up our next date at Frandor?
Yeah. The next one is Monday, November 16th. And we'll be at Gilead October 6th.
October 6th. Okay, wonderful. So we're not scheduled at our offices until the fall.
Right.
And because of this outreach that you're doing to support the community and educating them, we can always set up a sooner date if we're getting a response.
Right, sure.
We want to be able to support the community and support you in what you're doing in terms of educating.
Well, it's mainly for the community. Would you happen to be in Lansing any other time soon, or?
We are in Lansing every month,
Mhm.
and yeah, so we're always in Lansing about once a month.
And we are the office, which is in Bingham Farms. That's Telegraph and 13 Mile.
Mhm.
We're here for at least 4 days a week.
Okay, so if there's, you know, if somebody felt an urgency, they can just give you a call.
Right.
Yeah.
And we can
All
tell
right.
where and when.
So anybody on the call right now that might have a question, go ahead and type it in the chat. If you can, either chat or question and answer box here. We don't have any questions right now. All right, so I don't think I have any other questions myself. I learned a lot, and I appreciate
I just realized there is one other question. We are asked whether insurance covers thermography.
Right.
And it has been 45 years now, and insurance companies still insist that we're experimental. So no, they will not cover, but your health savings plan at work, you can use that.
Okay, and so you just need to, if they use their health savings account, they would just pay through that if they had a little credit card, or they would write a check and they would submit the receipt.
Right. Yeah, we take credit cards or checks.
Yeah. And
Okay.
I noticed that somebody is asking about the cost. The mobile unit ranges, what is it at?
175 to
Where is it with them?
190 at Rassel.
Yeah, so when we have to travel a longer distance, of course, the fee is higher. So it's 195.
190 at Rassel.
Sorry, 190.
Mhm.
And Gilead.
Yeah, so we have that, yeah, and that's extremely reasonable for the information, and especially
to know that your breasts are healthy, to monitor any changes you want, lifestyle changes, to support you in that for the rest of your life. Yeah,
absolutely,
it's definitely cost effective.
very reasonable, especially compared to mammography, which is like, how much do you know what the comparative cost?
I think it's about 300 if you pay out of pocket.
But let's remember that it is covered by insurance.
Yeah,
of course, people have their deductibles, but it's really the downside. It's having the radiation that can cause cancers. It's finding cancers too late. That's the cost of mammography, not the out-of-pocket expense.
I hear you very much. I think I did pay over 300, if I remember correctly. It was definitely, but
it depends on where you have it done. It all depends on where you have it done.
Yeah. However, it would not pick up anything 5 to 8 years at a time. Thermography is 90% accurate, and there's not anything that is 100% accurate, but we do know that thermography has been time tested over years, 40 years. So, you know, I know that I've heard nothing but great testimonials. People are very thankful that you come into Lansing and come into our offices. I've heard nothing but good comments. We've not had, and how many years we've only been doing this a few years, but
about 3 or 4, yeah.
Yes, I've had nothing but positive comments, and people are grateful that coming to somewhere that they're comfortable. They're not going into an office or place that they haven't had experience at.
And they don't have to drive an hour.
And they don't have to drive an hour, right? But now, let me just make sure that all right. And so the approximate cost, we've got that is $190 inside offices. So
no additional cost for the report or anything. That's all inclusive of everything.
Okay, and then that they do need to come with a medical doctor or DO, MD or DO name and email or fax number?
Name and address, but we can always look that up too, as long as we have a name.
And then you send the results directly to that MD or DO, and also a copy to the patient.
Right.
Okay, very good. Well, I appreciate you guys being available today. It was really nice chatting with you. And I look forward to seeing you again back at our offices in October, November. Once again, could you please, we have another question here.
Oh.
Do you have any recommendations of Lansing area doctors that would work with the results that that's a great question.
Absolutely. The first recommendation is to speak with Denise.
Yes, absolutely.
To make sure that you follow up with doctors who are open to lifestyle changes, diet changes, supplementation. That's vital. But we also do have a list of doctors that it's not ironclad, but we do have a list of doctors who refer to us for thermography. So they can always call the office and we can let them know if we know of somebody in their area. The easiest way is you go to someone you trust. And obviously your offices are people we can trust, and see who they know of in the area who's doing the best work and working alternatively with patients to be the healthiest they can be.
Just out of curiosity, is there a doctor here in Lansing that you know of that if they were to have a result that is less favorable, that they would need to see someone? Do you know someone, MD or DO, that works with women?
There are several in the Lansing area who actually refer or have us come to their office. Linda, who are they?
Dr. Wyckoff, Dr. Page Echoes, Dr. Nebling, Dr. Passett. Those are the four main ones that I'm aware of. I'm sure there's others.
And there are a number of organizations that list, that have functional medicine doctors.
Right.
If you look on functional medicine doctors, there are a couple of organizations and you can see who their members are.
Mm-hmm. And that's great. I know Dr. Nebling and Dr. Page Echols and Dr. Wyckoff, and they're all great resources here in the Lansing area as well. Well, I think that's it for today. I want to thank you guys again for being on the call and on the webinar, and we'll make this available for people who we can send to, or you can put this on your website, or however you want to use it.
Okay,
So
thank you
very much. Bless you guys, and we'll talk soon. Thank you so much.
Thank you so much.
Mhm.